My name is Andy Furlonger. I'm the membership manager at What We Do Now. What We Do Now is a creative placemaking network in Dumfries and Galloway. We're delighted to welcome today Lucy Bell, the director of Outpost Arts, and we're going to have a bit of discussion about what Lucy is doing out in Langham and some of the really interesting work she's doing in the field of wellbeing. Lucy, if you'd like to introduce yourself and just let us know a little bit about your role and the organisations that you represent.
Sure, thank you, and thank you for the welcome. Hi, everybody. I am Lucy Bell, and I'm the director of Outpost Arts. Outpost Arts is an organisation that was born from the east of the region, from Langham, and our base kind of remains here, but we are working regionally across D&G, working with regional partners to deliver DG Creative Wellbeing project, which is a project that focuses on increasing access to creative wellbeing opportunities and impacting on kind of community health and wellbeing and resilience.
Amazing. Thanks, Lucy. So we've got a few questions here and we just wanted to run through them just to dig a little bit deeper into what you're doing and just so that we can understand a little bit more about how your project is impacting wellbeing in the region. So the first one is, can you share some examples of how D&G Creative Wellbeing Programme has impacted both community and healthcare settings?
Sure, of course. This project was kind of born as a response to COVID and the way that COVID affected people and communities, which I think nobody needs to be told about that impact. I think it was just so clear. And everybody was impacted and all communities were impacted. And really, it was a bit of a response to that. And our first project that we established and that we developed the project around was something called the Art Journal Project. And it was a very, very simple and accessible project that just opened out access to creative well-being as a concept. And as a kind of, the idea was to kind of embed creativity on a daily, easy to access level for people to promote well-being in a way that they could truly access. So we started in a very basic way, but our ambition was always to grow that project and increase its access out from adults to young people as well. And over the past 2 years, we've managed to do that. The youth part of the project has kind of taken on its own identity, which is exactly what should happen with youth projects. You can't just shoehorn an adult, youth and young people into an adult project. So that's become Creative Toolbox. And one of our ambitions for that was to increase kind of community well-being and resilience by just opening out access to creative prescribing models and connecting the dots between the kind of third sector, arts and culture sector and health sector as well, to create a structure and an apparatus that people could more easily be referred into creative prescribing opportunities, but that people could also refer themselves into as well. So it didn't have to come through a GP. I think that's the common misconception, that social and creative prescribing is only through a clinical model, and that tends to be thought of as being the GP. And what we found very, very quickly was that it's not the GP. The GP is a very busy person who doesn't have a lot of time to actually learn about creativity and its impact on well-being, let alone assess people's kind of need. So we actually connected with health improvement teams and other clinical services such as CAMS, mental health services. And that's been a much more appropriate kind of structure, referral structure, and that means that we can actually kind of reach more people. And so that's one thing I would highlight, is that over the past 2 years, we've kind of developed this creative prescribing model that works for adults, and it also works for young people in quite different ways, and it responds directly to their needs and the barriers that they face on a regular basis. And in fact, it was designed by the services that people work with and the people themselves. So we designed it with adults and young people so that it does truly respond to their needs, and it understands how they live, how they access things, what are the difficulties, such as poor transport links or lack of funding, or lack of awareness is another, just how the art sector communicates to itself sometimes, and it struggles to communicate outwards. So how do we do that better? How do we make the language, easier to understand? And how do we pitch it so that we're not asking too much of people, so they don't feel threatened a lot about people's experience of art is often school, and unless you go down a creative and an arts, channel towards creative education and professional practice, often there's a real kind of a lack of confidence, and the feeling that art is very narrow in the way that it's taught at school, particularly high school, where it's streamed off into, if you can't draw, you're not doing art. So it's breaking those kind of concept and perspective barrier, people's perception, sorry, I should say. The other thing, because I know we don't have a lot of time, so I'll just quickly rabbit on a bit about the art and healthcare program as well. So through developing the creative prescribing projects and making those connections, we connected with NHS D&G Arts Strategy Group, which had been set up to establish an arts program around DGRI's build about 8 years ago, the build of the hospital, but it had wanted to kind of like circle back to maybe a formal art strategy to bring art into clinical settings. So we managed to kind of form a partnership and establish and develop an art and healthcare program. So I would signal that as being a really significant change for staff, patients, visitors, and the art and culture sector in D&G. Obviously, it's really impacted on freelancers and arts organisations, including obviously ourselves.
And what kind of challenges have you encountered in implementing that within this partnership?
Yeah, the partnership with NHS D&G, do you mean?
Yeah.
Yeah. I think the obvious challenges of just the stress. I think for any organization making a big change, there's just so many kind of the devil's in the detail around all this. How is this actually going to look on the ground? So like the coordination challenges, and it's been a massive undertaking, and it's not happened in our region yet. There has been small pockets of activities happening between the culture art sector and the health sector, but there hadn't been a kind of like a really foundational piece of kind of art and healthcare, like that kind of programming. So starting almost from scratch, but what we're really lucky to have is other regions that have been doing it for decades. So we're able to model, bring some of that learning into D&G. And I think that idea of network, and I think obviously that's the common thread with what we do now as well, it is that networked approach brings learning in and it shares learning out. So that challenge was slightly mitigated by being able to access others who have perhaps the answers. But the NHS is a very slow moving creature, and change is very difficult in such a large institution. So the challenge of just spreading the word, and that sea change of perception again within the NHS is hugely challenging, to get people to buy in and to understand what it is that we're trying to do and why we're trying to do it.
You mentioned some of the other regions that have been really helpful. Is there any particular region that's sort of really an ideal example of like best practice in this?
I think there are many, and I think the thing about art and healthcare is it should respond to the needs of the region, and all regions are different. They're set out differently. They've got different kinds of communities, communities with different challenges, and so it should really kind of be bespoke as much as possible. But you can absolutely highlight, key areas where, they've really established something in that way. I would highlight Forth Valley, ArtLink Central's work there, and that's they were very kind with their time and helped us along with some advice and some support. Kevin Harrison, the director of ArtLink Central, I would very much name check as being wonderful. Tonic Arts in Edinburgh as well, a completely different model. They're more of an in-house model where the Tonic Arts employees they're employees of NHS rather than a third sector organisation like ourselves, and ArtLink Central kind of coming in from the outside, embedded in the community. So they've had different challenges trying to reach the community. So I think the beauty of having a community-based organisation coming in and delivering art and healthcare is you bring all of the community connections with you and the understanding, because we must remember, a lot of NHS staff, for example, are too busy to be reached at work. And so we're actually reaching a lot of NHS staff in the community. So to have that understanding about how communities operate and how community arts, and other to be able to kind of understand who the players are within the community setting strengthens your art and healthcare program significantly. So to me, that's best practice.
And you were involved in the early days of what we do now, like from the pilot scheme, and obviously you're still involved, and we're in touch with you, I believe, quite regularly. Where do you see potential for collaboration and shared working between the aims of the What We Do Now network and that of DG Creative Wellbeing? I mean, you've mentioned a couple of things already.
Yeah, I think there will be things that unfold in the future that we're not probably aware of yet. I think a really interesting piece that I'm interested in is increasing the awareness of freelancers within the network and perhaps community non-creative and creative organizations within the What We Do Now network to understand actually the work that they're already doing, the impact on well-being. I think we're all doing well-being, you know, we just perhaps don't realize it or are a bit scared of evaluating it, or, you know, that kind of lack of awareness about how to kind of harness it, how to pitch your tent when you're talking about well-being. I think that's a really kind of common area of kind of fear and trepidation for creative freelancers and creative organizations. Is the minute you mention health and well-being, you kind of think, you know, oh, I feel like I'm out of my comfort zone here. I don't really quite know what the language or what the measuring tools are. So I think there's definitely space there to kind of collaborate and a bit of kind of learning and a bit of awareness and perhaps some, you know, kind of question and answer, or how do we bring in knowledge into that sector, into the art and culture sector. A bit more. It's not all going to come from Outpost Arts. We're not arrogant enough to think that we know everything, because we don't. We're learning as we go as well. And so I think that's a really interesting piece of work. I think that a journey that we can all go on together.
And you mentioned something, it's something that we have encountered a lot as well, and it's the sort of perception of the arts and how it's kind of got this, you know, maybe sort of upper class feel about it. People don't really like going to galleries, and we've spoken with some really interesting organizations who use things like inviting people in as the process is unfolding, so people are actually in the middle of the work rather than displaying finished work. How do you actually break down that barrier? And because you're in quite a rural area, I know Langham is not like a sort of metropolis. It's a very sort of, you know, it's a rural area, it's very dispersed population. How are you sort of communicating, and what are the sort of methods that you're using to overcome
just to
that?
clarify, we don't just work in Langham. So we're born from Langham as an organization, but we're working across the region. So we try to open up access for rural places, though. That was really kind of, I think that's been one of our strengths, because we've come from this rural setting, is we understand what it is to be rural, and we truly understand those barriers, because they are very real in D&G, you know, second only probably to the Highlands of Scotland. So one of the things we've been doing is working with our community creative wellbeing program. Our two programs, which I spoke about earlier, the Creative Toolbox program, which is coordinated by Georgia Ireland, and our art journal project coordinated by Liz McQueen. They've worked really hard to develop programs that engage participants and work with artists to develop that, to be part of the process. And we've been working with partner organizations and pulling their service users in. So a really good example for this is a project that we delivered last year, which was the mural project with Katie Anderson as the lead artist for CAMS. So for the mental health services for children and young people in Dumfries. It's based at on the Crichton campus at the Willows, Children, Young People and Family Centre. So they were taken on the process with the artist. The artist didn't, as you say, kind of go away and do their kind of alchemy and then present this kind of, you know. So that was really part of the motivation, was to break, you know, that third wall, to pull down that curtain, to reveal, okay, well, what is the life of the art? What is the creative process? You know, it's not just design and application, it's research, it's understanding, it's awareness, it's questions, it's get rid of your ego and don't think that you're right just because you're the artist. Sometimes other people have the answers, you know, and sometimes, you know, somebody else unlocks the kind of, you know, the secrets of the how the project should be. So the artist just being part of that, you know, and that true, it's the term that gets bandied around so much, that co-design. We all use it because we know it looks great on an application form, but true co-design, what does that really look like, you know? And where's the artist place in it, but where's the participants, you know, the community participant, and what can they gain from being part of that process rather than just coming along at the end, you know? There's so much richness in the process from a well-being point of view, particularly, and confidence and awareness and inspiration. You know, one we have, sorry, I'm doing a bit of a kind of a wee marketing ploy here, but we have got a draft creative wellbeing manifesto for D&G, and we try to kind of infuse a lot of this learning into the kind of 6 points. And one of them is art is a vehicle for change, but even small changes can be transformational. And sometimes just being a small part of a project like that can open up all sorts of doors, you know, just because you're, and then look at the impact. You've got something very tangible to show at the end of it that you can feel very, very proud of, that other people are benefiting from. Then you have those waves of kind of impact afterwards as it supports other people to feel comfortable and safe and happy in environments. And you've been part of that process. So the self-esteem and confidence part of that has a direct impact on health and well-being, you know, and then it can trigger all sorts of creative enterprise ideas as well about, I would like to, you know, perhaps start a mural or some kind of a project in my community, and I feel more able to kind of take that forward or work with others to take that forward.
Do you think, you mentioned about the clinician and like how it doesn't necessarily need to be a GP that prescribes it, but do GPs, is there any kind of, you know, is there a more acceptance of these kind of alternative approaches to well-being? Because I know, you know, things like meditation, for example, there was all this research and they've had neuroscience and so on show the benefits. But still, you know, if you go to a doctor and you say you're feeling stressed or whatever, they're not going to tell you to go meditate. They're going to say, take like Prozac or whatever it is they prescribe. So, I mean, it's sad because things like creativity, you know, the cost is going to be really low compared to some
100%.
kind of prescriptive drugs, like, and it's going to have, you know, the knock-on effects of the community, the beautification of areas. I mean, do you see like, are there sort of pockets of like acceptance within the medical world? Are there people that are promoting it in the NHS? Or
I think there are a lot of people who are ambassadors of this work and who truly understand. I think it's just it's keeping the momentum going and keeping it building, I think, is but there are lots of initiatives to build on that. There's the Scottish Mental Health Arts Festival is a really important initiative that brings, you know, the country together and spreads some of that awareness. Healing Arts Scotland was an event that just happened, which the World Health Organization kind of co-organised. So I think it's international, this understanding as well. And there is a challenge getting that learning and that understanding into rural areas because they do face those information barriers, you know. They're smaller areas with less people, and perhaps, you know, some of our healthcare providers are perhaps, you know, less plugged into some kind of global initiatives or national initiatives. But I certainly have been hugely impressed by the support that we've had from, you know, NHS D&G and their understanding at a really high level. You know, the public health team, the clinical teams, you know, managers are very open to hearing about new ways to support, particularly staff as well, who have been profoundly affected by the COVID pandemic. You know, they've gone, you know, straight from that into, you know, economic challenges as well. And working under such intense pressure. So I do think, you know, all of the elements are there. It's pulling them all together, getting them the motivation, kind of, galvanizing it essentially, and then kind of keeping it looking forward and thinking about, well, what's our kind of action plan? What's our regional strategy here? What is it? What does success look like? And working towards those things, but doing it in a really collaborative way. Because it does take a village, you know. It isn't just Outpost Arts. It is all of us, you know. All of us need to kind of like really get behind this and understand it better and be all faced in the same direction.
That is really interesting. Thank you so much, Lucy. I know you've got a very busy day today, so I'm going to let you get off. But thanks so much for your time. It was really interesting. And if anyone wants to find out more, is there a website or?
Yes, that we've got our social media, which would just be Outpost Arts on Instagram and Facebook, and we have a DG Creative Wellbeing website. At the moment, it's just being updated, so you might notice some changes, but it should be updated fully by the end of October. Sorry, the end of September. Yeah. I was forgetting what month we're in.
Well, thank you again for your time, Lucy. Have a
No
great
problem.
day, and we'll speak to you soon.
Okay, thank you.
Bye. Bye.
Bye.